My name's Rahini Vijay-Kaul, and I'm the nutritionist and advisory board member at Plant-Based Health Professionals UK. I'm really excited about today's webinar, and I know lots of you have been really looking forward to this one with Dr. Marco Springmann talking about the healthiness and sustainability of national and global dietary guidelines. Hopefully you all had a chance to read his recent paper in the BMJ that came out this July. Just a quick thank you to our sponsors who enable us to run these webinar series, along with your donations, which enable us to keep them going, and especially to ProVeg International and to the British Society of Lifestyle Medicine. These webinars are CPD accredited, so if you're a healthcare professional, you'll be getting a certificate in your inbox after this webinar, and you can just sign it and will be accredited with 1 CPD hour. We have lots of incredible events in the pipeline, and do join us for our next webinar after this one on the 30th of September. We'll be joined by plant-based nephrologist Dr. Shivam Joshi, talking about plant-based diets in chronic kidney disease, another really hot topic. And for PBHP members, we are excited to announce our second ever cooking social, which is going to be Middle Eastern and Whole Foods plant-based cook-along, where you can come along and meet other members virtually. Do join us as a member. This is open to everyone around the world, and we have lots more members joining us from as far afield as Canada to Australia. Visit pbhp.uk to subscribe to our newsletter, and donate if you enjoyed this webinar or want to support our work via pbhp.uk/donate. We're also very active on Facebook, Instagram, and Twitter. Thank you. So it gives me great pleasure to welcome Dr. Marco Springmann, who really needs no introduction. He's the senior researcher on environmental sustainability and public health in the Nuffield Department of Population Health at the University of Oxford. Most recently, he was part of the Eat Lancet Commission on healthy diets and sustainable food systems. We also have plenty of fact sheets on our websites about sustainable diets, so do go and check those out if you're interested in this topic. And we do plan to have future webinars relating to the connection between personal and public health and global environmental sustainability. So now I'd like to welcome Dr. Marco Springmann, and do stay tuned because after the presentation, we're also going to be having a live Q&A with him. Hi there, I'm just going to stop my video.
Okay. Hello, everybody. Good to be with you, even in this weird electronic format, but I hope this works out well. And yeah, let's start, let's keep going. So I'll just want to share my screen. Hopefully you can all see the presentation now.
Yes, looks good.
Okay, great. So let's dive right in. I mean, many of you will be familiar with the background of this. We know that imbalanced diets are one of the leading causes of premature mortality globally and in the world, according to the Global Burden of Disease study. Globally, the prevalence of overweight has increased by over 1/3, and obesity rates have doubled over the last 30 years. So one can easily say that diets are currently not very healthy at all. At the same time, current diets are also not sustainable. They are a major driver of climate change, land use change, biodiversity loss, freshwater use, and a major polluter of aquatic systems through, for example, fertilizer runoff. In an earlier study, we calculated that without dietary changes, there is an increasing risk of exceeding key planetary boundaries on those dimensions. And there is indeed just a very slim chance or no chance to actually meet those boundaries without dietary changes in concert with technological improvements and other food system measures. What dietary changes? Well, those would really need to be quite dramatic. So in high-income countries, we're talking about a 90% reduction in red meat, for example, halving of milk and dairy, and massive increases in fruit, vegetable, legume, nuts and seeds. in order to get to diets that are both healthy and sustainable when looked at it from a global environmental limits planetary boundary perspective. Now, the big question, of course, then is, well, how do we really get to those healthy and sustainable diets that we need to get to stay within environmental limits and also really have reduce those health impacts that we have at the moment? And the literature on behavioral change really suggests that integrated multi-component approaches are really what is best suited to bring about changes. Those approaches can include some amount of information education campaigns like labeling, other consumer information, national dietary guidelines that I will be talking about today. But they should also include fiscal measures such as taxation, subsidies, other economic incentives, school workplace programs, or direct restriction and mandates. So all of those probably need to be in the mix to get us where we need to be. But the topic for this evening really is national dietary guidelines. Just to give a little definition of those, national food-based dietary guidelines are political, government-endorsed documents intended to provide context-specific recommendations and advice on healthy diets and lifestyles. Ideally, and in some cases, they do form the basis for educational programs and national food and nutrition policies. So from my perspective, food-based national dietary guidelines are really an important starting point for food system regulation, in addition to just being a communication tool. So what we wanted to do in the analysis that I want to talk about today is really to analyze food-based dietary guidelines with respect to both their healthiness and their implications for sustainability. How did we and my co-authors do that? Well, we looked through all kinds of national dietary guidelines, transcribed them, coded the recommendations to arrive at something that could be described as a representative diet that describes how people would eat if they would really eat according to those guidelines. Then we subjected those diets to an environmental analysis based on environmental footprints, to a health analysis based on a comparative risk assessment, similar to the global burden of disease analysis. And then we looked at both the national and the global impacts. And the latter we compared to global health and environmental targets to have some kind of measure if the changes are really enough or not really enough. So I'll briefly go through those and describe that in a bit more detail before jumping into the results. First of all, where did we get the dietary guidelines from? Well, fortunately, there is a very big repository that the Food and Agriculture Organization of the UN is maintaining. That repository contains the links and summaries of food-based dietary guidelines of 97 countries. 85 of those were usable for us. Some links were broken, some didn't have any detailed dietary guideline link to it. Some we couldn't translate. When we could access it, we translated it with translation software. That is probably important to note. We supplemented those national dietary guidelines with global ones, and one are the guidelines from several guideline documents, really, from the World Health Organization, and another one are the recent Eat Lancet Commission recommendations for healthy diets from sustainable food systems. What we did when we were able to access and translate, if needed, those dietary guidelines, where we looked through key recommendations for 12 food groups, such as fruits, vegetables, meat, including red meat, processed meat, poultry. We looked at recommendations for legumes, nuts and seeds, eggs, dairy, including milk and other dairy products. We looked at whole grains, fish, let's see, and in sensitivity analysis, we also looked at fatty acids. And in addition to those food groups, we also looked at body weight, because that we needed to construct our guideline scenarios, because if it was recommended that people adhere, like balance their calorie intake, then we had some information to what kind of calorie intake we should move people to in those dietary guideline scenarios. All of those recommendations we looked through, and very early on we found that, well, a lot of recommendations are really not very understandable. Sometimes they just eat this every day, or increase consumption of this, or this and that is important. So we need to come up with some kind of coding mechanism to make it really coherent when we go through those different dietary guidelines. So we came up with this uncertainty score and this table of how we code it. So if a guideline document mentioned an exact value, for example, eat, let's say, 5 servings of fruits and veg with information of what a serving is, then we coded that exactly as is. If it had a range of value, we coded it as a range of value. And if it just said eat more, eat so and so much more, then we coded that as so and so much more and applied to baseline intake data. And all of those we assigned an uncertainty score of 1, meaning that is for our understanding a very exact recommendation. Then those uncertainty scores increased, the less exact they became. So for example, in the next step, they could say, well, eat so and so many servings, but they don't tell you what the serving size is. Then we use standard serving sizes from other food-based dietary guidelines in the region. And if those were not available, we used some that were that are used commonly in epidemiological research. Then less certain were recommendations like eat daily or eat this and that food group so and so often, and so on, until we finally arrived somewhere where it was literally too vague to code. So our approach was then, well, if you read such a recommendation, you're really at a loss what you should do, and you don't change what you eat at all. So then we left the population average diets in that country at that point. When we were able to construct those guideline scenarios, we coupled those to health and environmental analysis, as I mentioned. For the environmental analysis, we used commodity and country-specific environmental footprints. And here you have an example of how they look in average. So as you can expect, the animal source foods have usually a higher environmental impact, not only for greenhouse gas emissions, but also for many other environmental indicators like cropland use, freshwater use, and nitrogen and phosphorus application. In the health analysis, we ran those different diet scenarios through a comparative risk assessment framework. We included 11 risk factors, and those are written down here: high intake of red and processed meat, low intake of fruits, veg, nuts, legumes, fish, whole grains, and imbalanced BMI or body weight levels, and the associations those risks have with mortality from coronary heart disease, stroke, type 2 diabetes, site-specific cancers, and respiratory disease. I should note that we only use risk disease associations in those calculations that stem from meta-analysis of cohort studies, and that were judged as probable or convincing with moderate or high meta-evidence by either NutriGrade or NutriCode or the World Cancer Research Fund. Of course, you can find more information on that on the appendix of our paper, but I just want to reassure that we were very conservative in terms of what risk disease associations we used in that analysis. Lastly, what global health and environmental targets did we look at? Maybe first is good to note, why did we look at global targets at all? And here the idea was that, well, it could easily be that one country whose diets are very unhealthy and very unsustainable might be somewhat healthier and somewhat more sustainable if the population in that country were to adhere to dietary guidelines. However, that doesn't necessarily mean that those diets then would globally be sustainable. or adhere to other targets. So, for example, if they might still, if everybody ate like that, miss the climate change target of limiting global warming to below 2 degrees Celsius, which is the Paris Climate Agreement. So in order to find that out and have a more absolute comparison of where we get to if we eat according to dietary guidelines, we came up with this method of moving everybody in the world to that dietary pattern that a population has if it were to adopt its national dietary guideline, and then compared those global impacts to food-related targets for the Paris Climate Agreement of limiting, avoiding dangerous levels of climate change, of the IG biodiversity targets that basically look at land use change and biodiversity loss, and that are related to the Sustainable Development Goals. Then we looked at the Sustainable Development Goals related to water withdrawal and to nutrient pollution of nitrogen and phosphorus. And then lastly, we also looked at the NCD agenda that has a target of reducing by 1/3 premature mortality from NCDs. Those different targets map very nicely to the planetary boundary framework that we had used in our previous analysis, as well as in the Eat Lancet Commission. So we could really translate one to one here, which was rather neat. So with all that, let me jump into the results and show you what we actually found. So the first thing was that the dietary guidelines were really varied with respect to how precise their recommendations were. And here you see the overall uncertainty score. So for example, in terms of regions, the EU was slightly better than other regions. The US had very good, very concrete dietary guidelines, as did China and India. And if you looked at from a food group basis, then you can see that the top of the list are here fruits and vegetables. So most countries had recommendations on having a certain amount of fruits and vegetables. That was followed by milk, sugar, and the least concrete were for processed meat and then whole grains. What you see here too is that, by region, national food-based dietary guidelines differ quite a bit. But if you compare those to global ones, the Eat Lancet one was very comprehensive. So that had recommendations on all those different food groups, whereas the different dietary recommendations of the WHO were really not very detailed. So they only included concrete recommendations for fruits and veg, sugar, energy balance, and a vague recommendation on processed meat and whole grains. What were those recommendations like? Well, when there were recommendations, most of them recommended increasing the intake of legumes, whole grains, fish, milk, nuts and seeds, fruits and veg, and eggs, if you compared them to what is currently eaten in those countries. And they further recommended reductions in sugar, poultry most of the time, red meat, processed meat, and also energy intake. You would have noticed that sometimes the bars here are rather large, right? That is because the recommended intakes are so different to what is currently eaten. If you compare, basically, if you group those different food groups into recommended and discouraged food groups, based on their effects on health, and you look at which targets were actually attained, you see that hardly any country achieved very many of its own recommendations. So the adherence to any of those dietary guidelines was extremely poor. So that was really a shocking result. That also explains why when populations would show greater adherence to their national dietary guidelines, you would see quite a benefit in terms of reductions in premature mortality. And here you see the distribution of that. If you put that in context, on average, the reduction was around 50% in terms of premature mortality. It was, here you see a differentiation for risk factors. A bit more than half was due to changes in the composition of foods. Increases in whole grains were important, increases in fruits and veg, reductions in red and processed meat, increases in legumes, and slight increases in fish. And the other, a bit less than half, was due to balancing weight levels, meaning reducing overweight and obesity, and as well as underweight. What you also see here is that on average, the recommendations of the WHO, even though they were not as detailed, resulted in a similar health benefit, just because they were a bit more consistent on the whole grain recommendation and on the BMI recommendations. However, if you compare that to the Eat Lancet recommendations, you see here that those would usually result in a more than 30% greater reduction in premature mortality. And you see that additional benefit of moving to those recommendations in all countries and in all regions here. And most of the time that would be due to just being more comprehensive on the food groups, especially on red and processed meat. This is an example of how the environmental indicators change. So here you see the percentage changes in food-related greenhouse gas emissions. And you see that in most regions, there would be some reductions in greenhouse gas emissions. But as before, that differed vastly across regions. And here you have a very unwieldy bar chart, really. But this is just to show you that on average, the reductions were around 13%. Most of it was due to reductions in red meat, specifically beef or lamb, which were slightly compensated by increases in dairy. For the other environmental indicators like land use, water use, nitrogen and phosphorus application, those were a lot of times fairly balanced because you had increases due to more fruits and veg and more dairy, but you had reductions when, for example, it was advised to balance your energy levels better, so then you would have less consumption of staple crops. And most of the time you would have small reductions in in red meat as well. So that would also bring it down, that in total it would be fairly neutral. Some things stick out here. The Near East has very high dairy recommendations, so that shoots up the environmental resource demand. And if you compare again those national impacts with the WHO, then you see WHO again, similar impacts in aggregate, and Eat Lancet impacts would be vastly reduced greenhouse gas emissions and also reductions in some of the other environmental resource demands. Those are all impacts in those different regions. So the next question is, for example, if you look here at the US, has a reduction in greenhouse gas emissions of over 30%. Is that a lot? Is that enough to actually meet the Paris Climate Agreement and if everybody were to eat according to those guidelines? And the answer is probably not. Here you can see the number of global health and environmental targets that would be attained if people move to those different national food-based dietary guidelines. And the headline finding here is that 98% of food-based dietary guidelines did not meet at least one of those targets, and 67%, so 2/3, only fulfilled one or two targets. So that's a very dismal performance here. The ones that did better were Indonesia and Sierra Leone. They were pretty good. India is pretty good too, as you can see here. So what those had in common was that they recommended only moderate amounts of animal source foods or didn't have any in there, which meant we left them at their current low consumption of animal source foods. So it doesn't necessarily mean that their good performance here means that it's a model for everybody to adopt if they just didn't have very concrete targets. Nonetheless, you can see here what the drivers are. By region, you see here which targets were especially missed, and what sticks out here is really the climate change target. On average, it would be exceeded by over a factor of 2, and especially bad in North America, which includes the guidelines of the US and Canada here. even if everybody moved to those rather concrete targets of the US and Canada, then still we would basically need 4 Earths to balance the greenhouse gas emissions in the atmosphere to not to avoid dangerous levels of climate change. Where do those overshoots come from? Well, as you might have guessed, they are usually due to not stringent enough limits, if there were limits, or too big encouragements of dairy, and not stringent enough limits on the consumption of red meat. You can see that basically 80% of the impacts on the climate change target were due to the consumption of beef, lamb, and dairy. So most of it would be beef. So that really shows you where national and international food-based dietary guidelines would need to change if we were to really limit food-related greenhouse gas emissions in line with avoiding dangerous levels of climate change. We did lots of sensitivity analysis and uncertainty analysis of those, but I'm happy to discuss those in the discussion time, but I just want to basically get to the takeaway messages here to have a bit of time to talk to all of you. So I hope the takeaway messages are fairly clear, at least in general. Dietary guidelines inform or should inform national policies, such as health programs, public procurement. But our finding really shows that many dietary guidelines, well, most dietary guidelines really are not sustainable when adopted globally, which is, we think, a very good measure of whether a guideline is sustainable or not. And most could be healthier as well. The clear reason for that is a lack of limits for animal source foods, in particular red meat and dairy. So updating guidelines in light of both sustainability concerns, but also the latest evidence of what a healthy diet is really an essential first step for progressive food policy reforms. We think the Eat Lancet recommendations could be a good starting point for reforming national and global dietary guidelines. They resulted in a third greater reduction in premature mortality, a more than 3 times greater reduction in greenhouse gas emissions, and a general attainment of global health and environmental targets. I mean, you might say, well, in a way, those guidelines were constructed such that they meet those objectives. If you want a little example, and I provide I insert a link here to all the country level results, so you can look through those for the country you live in or you're interested in. Here an example for the UK, we found that adoption of the Eat Lancet recommendations would result in a 70% reduction in food-related greenhouse gas emissions compared to a 17% reduction if people were to follow the Eat Well guidelines. The adoption of the Eat Lancet recommendations could also result in 104,000 avoided diet-related deaths compared to 78,000, and the general attainment of the Paris Climate Agreement and the other environmental targets compared to exceeding the Paris Climate Agreement food target by more than a factor of 3. If everybody in the world would eat according to the Eat Well guidelines. So, of course, in addition to just stressing those essentially flexitarian dietary guidelines, we think it's also important to really provide not only one exemplary dietary pattern, but looking through several different examples of how healthy and sustainable diets could look like. In the paper, we ran through comparisons not only of the middle of the road flexitarian Eat Lancet recommendations, but also pescatarian, vegetarian, and vegan dietary patterns that were nutritionally balanced. And we found that, as you could expect, the more plant-based you go, the lower the greenhouse gas emissions, the greater the further health benefits to be attained. So we think it would be really good if national and global dietary guidelines could really have multiple examples of how healthy and sustainable diets can look like, and those should include also we think plant-based ones, which were amongst the best performing one in that sensitivity analysis. All of those, all of reforms of national dietary guidelines or global national dietary guidelines really don't matter much if the poor adherence that I talked about in the beginning continues to be a problem. And for that, really proper investments in health promotion programs, in school and work plan canteens and public procurement programs and so on would be needed to really help the population to adopt or eat according to national dietary guidelines. In addition, we think really policy coherence is key as well. It can't be that, for example, the national dietary guidelines recommend a reduction in red and processed meat, but the national agricultural strategy recommends an increase in the production of red and processed meat. Also here, really policy coherence is really important. And just to bring that home, here's a little graph that shows you if you use standard methods of valuing just the health benefits that you could attain by moving a population to those different dietary guidelines, you could see that on average, those would represent 20% of GDP if in the most progressive case here. So that is massive, and that should really give politicians a little bit pause for thought and thinking a bit more strategically and practically about making sure that it's easy for a population to adopt healthy and sustainable diets. With that, I want to thank you. I want to thank my co-authors that are listed here. The paper is online, the supplementary data is online, including all the national level information. So if you have a question or you can't find it, please write to me and I'll send you that. And now I'm looking forward to talking to you. Thank you very much.
Hi, thank you so much for that. I learned a lot, and there's quite a few questions in the Q&A to get to. So I'll get started. The first one that I'm going to ask is from Dr. Shireen Kassam, who is the founder of Plant-Based Health Professionals UK. And she would like to know, how do we change the narrative? The general public currently don't even follow the guidelines as they are at present, and the government continues to promote meat and dairy, for example, subsidizing it and offering cow's milk in schools.
Yeah, well, that's really the million-dollar question, I guess. I think it really, it's really key that civil society and academia puts a little bit more pressure on government to really both get the dietary guidelines in order, but also align policies in other sectors. I mean, in a lot of countries, I think there is a bit of hesitancy in reforming dietary guidelines, which is really a shame. So I think having really an automated system where it's clear that those guidelines will be updated every 5 years or at a certain time step, and really based on the scientific evidence of what a healthy and sustainable diet is really key. I mean, we found that those Eat Lancet recommendations turn out to be fairly good, but that doesn't need to mean that they need to look exactly like those. But I think what is important is that there is a proper process in place by which they're updated. And something that comes close to such a process is probably how it works in the US, where it's clear those are updated regularly. But even there, we see that it's not really science-based. Every time they produce a very nice science-based report, but then the recommendations turn out to be very different than the science-based report. So I think it needs to be, from an institutional perspective, very clear how those guidelines are made, and there should really be no food industry and agriculture industry should really have no seat at the table there whatsoever, because this should be about health, the health of the people and the health of the environment, and not about private interests there.
Yeah, I couldn't agree more. And one of the things that repeatedly comes up in the plant-based nutrition community, and even sort of it's quite divisive almost, is the issue of fish, which you touched on, but I'd love you to go into a bit more detail about fish. We're constantly told as nutritionists and dietitians to recommend oily fish, and to sustain a global population of 7.7 billion people, the Eat Lancet recommendation is that you should eat fish twice a week. What are your views on that?
Yeah, fish is a very tricky issue. So fish can either be as impactful as beef if it's a certain type of fish, or it can be fairly sustainable. And it really depends on, so the more sustainable ones are probably small pelagic fish, when we talk about wild caught fish that don't need like big nets to be caught. But it's clear that very many fish species are also overfished. So if everybody were to eat lots of wild caught fish, we would have more overfishing. So that's not a solution. And lots of fish at the moment is already comes from aquaculture. But also there are good practices and there are bad practices. And there are some good resources online that map what sustainable aquacultural practices are and which fish species at the moment are okay. But in general, I think it's important to highlight that fish, having fish in your diet is really not a necessity. So very many people always stress, oh, you need it for omega fatty acids. But we know that those omega fatty acids you can obtain from seeds and other plant-based foods. There is some interchangeability between fish-derived and non-fish derived ones. And in good randomized control trials, it was actually found that supplementation with omega fish capsules of omega-3 fatty acids didn't really lead to any health benefit. So what seems to be emerging is a picture, if you look at well-controlled cohort studies, that fish seems to be just much healthier, or let's say it in a different way, less unhealthy as red meat. So whatever you use instead of red meat is a good thing. And it seems to be that fish eaters usually, for one, don't eat as much red meat, and for two, eat more fruits and vegetables. And if you control for those things in cohort trials, cohort studies, you will very often see that it's really not much, it's really not significant anymore, the health benefits attributed to increased fish consumption, which suggests that, well, if you eat more fruits and vegetables and you eat another plant-based protein source like legumes or nuts, you're probably as well off, if not better. So I think that is important to highlight as well, that you don't need to load your diet with fish to be very healthy.
Yeah, I definitely agree. We have our own plant-based version of the Eat Well guide on our website for anyone who wants to check that out. And of course, there's great sources of alpha linoleic acid and chia seeds and black seeds and hemp seeds and so on. And there are also vegan and completely plant-based DHA and EHA and EPA algae derived oils as well for anyone who wants that additional supplementation. But yeah, it's a really, I think it's something that comes up again and again. Because many of the people on this call already, and many of our members are already kind of following an exclusively plant-based diet, one of the questions that I have is, what can you do if you're already following an exclusively plant-based diet? What can you do to make your diet more environmentally sustainable as a consumer?
Lots of people always talk about food miles and organic and all those things, but I mean, however much we look, it's really the choice of food group that you consume rather than the specific production practice. So if you're already plant-based, you probably have already a fairly sustainable diet. If you want to go more, one thing that might have an influence, for example, on biodiversity, is whether food was produced in an agroecological way. So for example, organic is an example of agroecological production methods. That can be more in line with biodiversity targets, but we also know that biodiversity targets depend on having land available that you can take out of food production, that you just leave for rewilding. And for that, sometimes non-organic production methods might actually work better. So even in that example, you see that it's not very clear what else to do there. And as is transport, right? So a well-rehearsed example is that it would be more environmentally sustainable if you look at greenhouse gas emissions to import tomatoes from Spain than to grow them here, buy them from a heated greenhouse. Just because they grow so much easier in Spain, and here you would indeed need those greenhouses or an increased application of fertilizers to make them grow. So most other things really don't matter so much if you already cut out animal source foods from your diet. One thing I should maybe mention that my colleague Joseph Poor always brings up is that some stimulants like chocolate and coffee in the past have been very much associated with land use changes, which are then further associated with biodiversity loss. So if you eat chocolate or you have coffee, maybe look for certain certification schemes that at least have some measure of control, whether it's newly, if it's from an established farm or if there might have been some land use change that would be detrimental associated with it.
That's really interesting. And in terms of what we just talked about, are there any countries that are ahead of the game that you would really want to kind of shout out? I know that Canada made some changes, but it'd be great to hear your thoughts on whether there's any good examples out there.
Yeah, we were sort of hopeful also with Canada having had such a nice sort of visual presentation of their new dietary guidelines that they might turn out very, very well in our analysis. But we found the guidelines were hardly usable at all because they chose to be completely qualitative. So they just tell you, okay, a healthy diet should contain those and those foods, but they usually don't really tell you how much of those. They don't really highlight all that much the substitution possibilities, even though their picture portrays a very nice looking plate that is very similar to the Eat Lancet plate, for example. It actually doesn't make any reference in the guideline document to that nice visual depiction. So, which is really a shame. So I think they really missed the opportunity to providing exemplary dietary patterns that would be aligned with their vision. And I guess they had some kind of progressive vision, but I think if you actually read the guidelines, it's a bit lost there, unfortunately. So I could only encourage, if you develop those, really think about how a guideline is operationalized by a consumer, right? What do you get out of it? And what are examples that would be in line with those guidelines?
It has to be accessible. And on that topic, there's a great question in the Q&A, which is that one criticism of the Eat Lancet guidelines is that the diet would be unaffordable for a large amount of people. Is this due to the way that we subsidize animal products in the West and the lack of funding and access to healthy foods such as fruit and vegetables?
Yes, in part. So what is alluded to here is a study from colleagues from Tufts University that looked at the affordability, and they found that in low-income countries, the Eat Lancet diet wouldn't be affordable. We are currently having another paper under review that looks at that in a bit more in some bigger context. Because the thing in low-income countries is that diets there are so monotonous and based in large parts on starchy grains or roots, that any change to their currently very poor diet would be associated with an increase in cost. So basically saying that the Eat Lancet diet is unaffordable, whilst true, is a little bit of a misrepresentation, because any other diet that would be healthier and or more sustainable would be unaffordable, as would be diets that would be clearly unhealthier and unsustainable. So if you think about a medium time perspective, where would you, I mean, change is not changing is not an option for people on those poor diets. So the question is really, do they change to diets that in the long term are healthy and sustainable, or do they change to something like a US diet that is unhealthy and unsustainable? And there we find in our new analysis that in the medium and long term, it would surely make sense that to build up food systems such that populations in low-income countries can change to a more balanced, healthy, and sustainable diet like the Eat Lancet diet. We also found in that study that in all high-income countries and in most middle-income countries, the Eat Lancet recommendations would lead to diets that would be more affordable than current diets. So, and the population living in those countries is the majority. So, for most people, dietary change to those guidelines would mean a financial benefit, and we find that. Also, the more plant-based of those recommendations you go, the more your savings can be there.
And again, on this topic, I think that this is one that's kind of really sparking a lot of questions. And one of the other questions that we have is that someone's saying that the talk was excellent, but they're worried that we're sitting in silos and that the only way to make real change is by addressing the socioeconomic determinants of health. So getting, investing in concepts like universal basic income, giving everyone meaningful employment, education, access to affordable housing, and so on. What would you say to that in terms of, this discussion around sustainable diets?
Oh yeah, I couldn't agree more, right? I mean, if you think about just from the dietary change perspective, why do people eat what they eat, right? And most of the time, it's habit, it's what's available, it's what is affordable, it's what their surrounding determines them to eat, or their friends. So it seems to be clear that the whole food environment has to change. And if we are specifically looking at people in low income segments of the society, very many of them wouldn't be so much in line with what science turns out, right? So they just eat what is there in their burrows, and very often, they have like 5 chicken chops next to them instead of anything that where they could buy something that is healthy and sustainable. So I think what can help there is not only, really health promotion programs that take them by the hand and show what a tasty, healthy, and sustainable diet could look like for that segment, including maybe the cooking demonstrations and things like that, but also things that would actually provide funding for such things, because very often local borrowers would say, well, for us, we're just scraping money from anything just to cover basic operations. But I think what can provide a lever here is thinking creatively about fiscal incentives and, for example, full cost accounting in foods, which would mean integrating the large climate change costs and the large health costs, healthcare treatment costs into the prices of food, which would make red and processed meat, for example, much more expensive. And the revenue from such taxation schemes could really be used to help fund health promotion programs that make it easier for populations to adopt healthier and sustainable diets. And that allow also those low income segments of a population to have a financial reward, because also for them, many of them would be at the moment on fairly unhealthy diets that still contain large amounts of animal source foods. If they were able and provided help with changing to a bit more plant-based diets, then that is something they would also feel in their pocket. But they won't change without help, right? So I think indeed changes to the food environment are essential here.
Yeah, I think there's a lot of amazing information in that. There's some great organizations doing really good work in the UK, like Maiden Hackney is one of our affiliate organizations, the plant-based community cookery school, which is fantastic. And one of the questions which is kind of, as the person who asked it says that this is often used to say that a plant-based diet isn't sustainable, is that are lentils and chickpeas flown across the world really more sustainable than locally grown meat and dairy in the UK? I think this is like the question that comes out every time. I'm sure you get asked it a lot.
Yes, absolutely. So first of all, transport-related emissions only make up around 5% of food-related emissions. So it's a very small portion, and the reason is that hardly anything is flown. It's expensive for companies to fly food products around the world. So most things would be shipped and then transported by road. And that if you think about how much you can pack on a boat or ship, that results in a very low proportion. Second, there is a huge difference in terms of the emissions that are associated, for example, with beef than with lentils. The estimates of that are that there is more than 100-fold difference, 100-fold, right? So if you compare a kilogram of beef to a kilogram of beans and lentils, and the reason is really that cows produce an awful lot of methane when they digest food. They need an awful lot of food to put on body weight. Estimates there range from 10 kilograms to 50 kilograms to put on 1 kilogram of body weight. And all that food, even if it's just grass, would have been fertilized. And even grass very often is fertilized to some degree. And the fertilization generates a greenhouse gas called nitrous oxide that, in addition to those direct methane emissions, is responsible for the vast majority of food-related emissions. So yes, lentils will always be one of the lowest emission sources of protein and of food in general.
That's really great to know. And on the topic of another controversial legume, I've got a question about soya, which I know there's always so much misunderstanding about, whether it's from the health perspective or the environmental sustainability perspective. And my question is, if you are already on an exclusively plant-based diet and you have the economic privilege and the education to be able to know, what is a healthy plant-based diet, should you be, I guess this is a subjective question, but do you think that it would be wise to recommend consuming alternative types of plant-based milks and other plant-based protein sources rather than tofu or soybeans?
We don't think that there is a good basis to recommend that. So we did some analysis for the World Economic Forum, I think 2 years ago or 1 year ago, where we looked at meat alternatives. And there we found that most of those, if they're processed, would have a environmental footprint that is a little bit in the middle between unprocessed plant-based protein sources like beans and lentils and the next highest animal source food like pork, for example. So just because of the processing, right? So from that perspective, unprocessed legumes are always better. But if it's much easier for you, and I should say, most of those processed products, they also contain much higher amounts of sodium, for example, which isn't very, adds to a health detriment, basically.
And possibly palm oil as well, am I right? Sort of palm oil and some of the processed substitutes.
Yes, for sure, sometimes palm oil.
Yeah.
Coconut oil very often as well, which is also not so good from the fatty acid composition because it contains more saturated fats. So unprocessed legumes are always better if you prepare them yourself. If it makes it much easier for you to adopt a plant-based diet, then yes, it would still be better than a diet that is high on animal source foods. So for example, the easiest thing, the clearest is probably for plant-based milk alternatives. All of them would have at least a third of the emissions of regular milk. And most of them would be balanced in terms of the nutrient profile when you think of calcium and potassium. Most of them would actually have more potassium and also have a bit of fiber, but the calcium is usually balanced because they just put a couple of supplements there. Not that one necessarily needs to worry about that. But so for those, there is an easier argument to say, yeah, go for it. But for meat alternatives, as you said, there are so many additives in there. I wouldn't recommend them myself. But as I said, if it's easier, there you go.
Yeah, I think that's a really good, meeting people where they're at, but it's good to know that a whole foods plant-based diet, which is what we recommend at Plant-Based Health Professionals UK, is also beneficial from the environmental perspective. And I think just time for a couple of final questions. One of the questions is that Marcus Group is producing world-class data on this topic. Are he and his group engaged in lobbying and asked to present to government?
Well, occasionally. So at the moment, or over the last 2 years, probably there was this push of developing a national food strategy. So we talked to Henry Dimbleby, who was heading that a couple of times. When there was a chance, and I'm asked, and I also speak to members of parliament. So we try what we can to talk about our studies, and I mean, whatever public interest group is involved in this field, we are always happy to help whoever. We also talked, for example, when the Eat Lancet report came out, we also took part in workshops with farmers who were very angry because they didn't like our recommendations. So we also engage with that group because I think it's very important to indeed make sure that farmers are not left alone, and that there is also greater understanding of why also the agricultural system really has to change, and to work together to maybe lobby government to give them the necessary support to diversify their production and really reduce the high reliance on beef in this country.
Great. So one more question that we have is, Marco, do you think that the metric of carbon opportunity costs, i.e. what else could be done with agricultural land, can be adopted more widely by scientists in the future?
Yeah, I think it's an interesting metric. That question probably comes from this new study by a colleague of mine, Helen Harwood, that just came out. That was termed carbon opportunity cost of land use change. I think that's a great metric to look at. It integrates those things. And if we think about what really needs to happen in terms of the food system, it's clear that we both need to reduce the carbon intensity of food production by dietary shifts, but we also need to find a good way of what to do with the land. And the International Panel on Climate Change has put forward some estimates of what we need that land for. Or what we need land for, period, right? And in addition to food production, we also needed to properly a forest, because we need to suck some more carbon dioxide out of the atmosphere, and we probably need a part of it also to grow bioenergy crops that don't compete with food crops, so new generation bioenergy crops like switchgrass or something. And both of those uses, if you put them together, they're almost as big as all cropland. So they clearly have to come from pastures. So, and that is really a good way of thinking about what else can be done with pastures if you move to a food system that is lower in animal source foods. And that gives an opportunity also for farmers really to get some income if they get income and subsidies based on ecosystem services rather than on food production or just having land.
Okay, that's so I think we just got time for final question, but I want to kind of end by asking you, what can we do as healthcare professionals and as consumers? What would you say, apart from obviously everything you recommended that we can personally follow, but what can we do to bring about change, and where do you think we can have the most impact?
Well, don't get tired talking about it. I think you guys put out very good summaries of where the science is at the moment. That is tremendously useful, I think. If it's possible to get that information more into the heads of practicing healthcare professionals, that would be excellent, because very often, as you know, lots of medical doctors, for example, other healthcare professionals, they don't really get much education on diets and dietary change and the implications.
Yeah, so, that's exactly why Shireen started our group, and we have about 450 members, most of whom are practicing doctors, dietitians, we've got GPs, nutritionists, and so on, and of course other members of the public. But that's our real aim, is to educate healthcare professionals, because they see thousands of patients and have the opportunity to be leaders and be kind of champions for this. And
exactly. And I mean, they're usually trusted resources, right? Because they treat people and they care for people's lives. And I see, for example, in Germany, there is a good movement as well where healthcare professionals really formed almost a lobby group to coordinate calls for healthier and sustainable, for strategies and policies that would further healthy and sustainable diets. So yeah, I think those things can be tremendously beneficial in really helping the move towards diets that don't harm us and the planet. So yeah, keep on with your good work.
Thank you. You know, I think that's very reassuring to hear, and you know, positive note that we just have to keep going. We have to keep, you know, spreading the word and putting out the information and trying to speak to other colleagues and influencing colleagues who may not already know about this as well, and who may not already be trying to include more plant-based foods in their diet. And yeah, spreading that message to their patients. So I know that we've already had some good case studies of this, and hopefully we can share more with you in the future. But thank you so much for giving up your time and putting so much effort into this webinar and being there to speak to our audience. It was really, really interesting. And it's, you know, whilst we focus on nutrition, it's very important to us to also focus on the sustainability aspects of diet, because they're just so interconnected, as you've shown throughout the presentation.
Yeah, exactly. Yeah, thank you very much. I really enjoyed this, and yeah, best of luck in what you do.